And now, a sports tip brought to you by Children's Healthcare of Atlanta and Comcast Cares. Each year, thousands of Georgia children and teens participate in sports ranging from varsity soccer to kickball in the backyard. Parents should be aware of an uncommon heart condition called sudden cardiac arrest, which can result in sudden cardiac death, or SCD, which happens without warning. This sudden loss of heart function is estimated to affect 600 to 1,000 children and adolescents every year in the United States. Proper risk screening is the recommended first step in predicting and possibly preventing SCD in children and adolescents. Pediatric cardiologists and sports medicine physicians at Children's Healthcare of Atlanta recommend SCD risk assessment screening review periodically by your child's pediatrician during well-child checkups and or before the start of high school sports. The Georgia High School Association endorses the use of a standardized pre-participation physical evaluation, or PPE, developed by the American Academy of Pediatrics for students participating in high school sports. The PPE form is designed to better identify at-risk athletes and prevent sudden deaths on the playing field. Unlike many of the past forms used by high schools across Georgia, this form is designed to capture more information that will identify undiagnosed heart problems. Student athletes must visit their primary care physician prior to the start of each season. During this visit, the doctor will conduct a routine physical evaluation and sign the form approving the athlete for safe play. If during the visit the doctor suspects a heart condition, your child will be referred to a pediatric cardiologist for further evaluation. It is important for parents to know all details of their family history, especially the following: sudden, unexplained, unexpected death in family members less than 50 years of age, unexplained seizure, for example, passing out, known family history of cardiac diseases causing sudden cardiac arrest, unexplained accidental deaths such as drowning. Visit www.choa.org/sportsmed to download a copy of the PPE form for your high school athlete. For younger children and non-high school athletes, the Children's Sibley Heart Center recommends a periodic history using the Pediatric Sudden Cardiac Death Risk Assessment form. Some conditions that can put a child or adolescent at risk for sudden cardiac death can affect the child before adolescence, and not all children will receive pre-participation physicals for high school sports. Many of the children at risk will have symptoms such as atypical exercise-induced chest pain or shortness of breath, exercise, emotion, or startle-induced seizure or syncope, which could be discovered during this periodic review history. Many diseases are genetic or familial, thus many family members may be at risk and affected, so this form also educates parents about potential risk factors in their family. The Pediatric Sudden Cardiac Death Risk Assessment form can be used by any healthcare provider at any time for patients from birth to age 21. Recommended use would be during the newborn period for pertinent family history, during physicals for children ages 6 to 8, during the middle school years, during high school, especially for non-athletes who will not be subjected to the pre-participation physical evaluation form, and or whenever episodes of unexplained fainting, near fainting, or seizure activity occur. Visit www.choa.org/heart to download a copy of the Pediatric Sudden Cardiac Death Risk Assessment form to fill out and take with you to your child's next checkup. Heart-related conditions can be scary for parents, but use of the pre-participation physical evaluation form and Pediatric Sudden Cardiac Death Risk Assessment form helps identify at-risk children, teens, and their families at the earliest possible time so that referral to a specialist and treatment can be timely. This health tip was brought to you by Children's Healthcare of Atlanta and Comcast Cares.